Hi everyone. I'm doing an interview today with my grandma who has Parkinson's, just to ask her a little bit about what it's been like so far and her experience working with speech therapists and other medical professionals. So thanks for interviewing with us today.
Oh, it's my pleasure.
Thanks. So when did you receive a Parkinson's diagnosis?
It's been approximately 12 years.
Okay. And what has the progression of symptoms been like with your moving and motor movements and your speech?
Well, I went from shaking my hand. I started with just my hand shaking, mostly, and then I progressed to the shaking was not as visible, but it was more internal. Like my knees shake sometimes, my hands shake sometimes. Sometimes I shake all over. And so that's been real annoying because I never know exactly how I'm going to feel or how I'm going to walk. Because when I'm shaky, I don't walk very well, and I am have to use my walker during that time. So I have to make a judgment whether I should take it or not take it, and use it and not use it. It just keeps you don't know what's going to happen next. It just keeps you on edge. And you have to learn to live with it, really.
And what have you noticed about your speech?
Well, I noticed that it's shaky. It sort of quivers,
Mm-hmm.
and it's lower than it was, and I have difficulty forming the words sometimes. I know the word, but I can't really get it out.
Mm-hmm.
It takes me a little while to be able to get it out. Everything has slowed down, so that speech has slowed down too, and it's more quiet and soft and more. I think it's hard for people to understand me sometimes. So it's not something that worries me, but it's something that I'm concerned about because I feel like I like to talk to people, and I feel like it's difficult for them to listen to me sometimes. So that's the main problem I have with it.
Yeah, like trying to make sure people understand you and you can communicate everything
Right.
you want to say.
Right. But the speech therapist has helped me tremendously.
Yeah, what are some things that she's done with you?
Well, she's taught me how to breathe and to take a deep breath before I start to speak. And and she's helped me to just relax more and not be as uptight about it. And learn how to breathe is the most important part of it. That's what I needed more than anything.
Yeah.
And so I need to be practicing now as we talk. As I speak and to you, I need to be taking that deep breath and doing what she told me to do, and I do remember that. It's interesting that she talks to me when she's not even here.
Yeah.
And I hear her say what to do and what not to do. But she had the right tools to work with. When she came, at first I thought, I don't know what she's going to do. I don't understand. I don't think I have that much of a problem, but I did, and I still do. Sometimes I go back to the old habits. It's hard to adjust to something new when you've been doing it for as many years as I have been.
Yeah, it takes a while
So,
to.
yeah, but she was very good.
What are some exercises you did with her to help practice using the deeper breathing and techniques?
Well, I read her stories, and that helped. She had some meters and some things that measured how loud I was speaking, how forceful it was, and that me being able to read to her, she could keep up with the speed and everything, the volume. And she was grading me as I was going. And so we found that worked real well for me to read to her.
And what are some things when you take the deeper breath? What are some things that you notice that change about your speech?
I think I have a deeper more control over it, a deeper awareness of it, and I have more control. It's not as shaky when I'm real aware of it.
Yeah.
If sometimes I realize that I'm not doing what she told me to do, and I get back on track. But it's just not as raspy when I'm breathing right and speaking after I've taken a good breath, and it's more pleasant. So that's been helpful.
Yeah, that's great. So I know some things that you've tried different medicines in the past through your doctor. Were there any that have helped for you and that you're currently using to help with some of the symptoms?
Oh yes, there's three different ones I take. One is Maripex ER, and the doctor is real pleased with the Maripex, especially with the way it's helped me. He said that he doesn't have a patient that has done as well.
Wow, that's great.
And then he said, in fact, I can't think of anybody I know that's done as well with the Maripex. So I think that's a real blessing.
Yeah, it definitely is. So I know that soon in the future we'll be going out and working with patients as well for speech. And what are some advice that you may have for us as future speech pathologists and working with people who have Parkinson's or other disorders? What would you kind of say to us?
I think just to be friendly and have a positive attitude, and help them adjust to new things, because there's so many changes that take place.
Yeah.
And I think to be able to keep a positive attitude for when you're with the people, and just be pleasant and helpful and giving good suggestions and advice. I think you probably won't realize how much it means to them until you've been doing it for a while, because it just seems to be something that naturally you should be able to do. But when you have Parkinson's, there's things little things that happen to you that you don't expect, and it takes a while to adjust to it. And I'm trying to think of some examples. that I've experienced recently. Well, some things, like the shaking, um, sometimes it feels like I'm not shaking, but the floor is shaking, like 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 an earthquake, like that kind of shaking underneath my feet, and not my feet.
Yeah.
And so that's, I mean, that when that happens, that's real unusual. And and I have to adjust to that at that time. And usually I sit down, but there'll be little things happen that I don't expect. So it's just like I say, it's just a big change.
Yeah. That's a great advice to really stay positive in the midst of it and help you as you're going through the change and everything you're experiencing with that too. So to be supportive in that.
Yes. So. Oh, definitely. That's important.
Yeah.
You have to get the attitude that this thing is not going to steal your joy. You have to have a positive attitude. And I learned a long time ago that being anxious doesn't produce anything positive. It just makes things worse. So it's important to have a positive attitude and be up. And then I think you defeat the disease. It's your enemy, and you have to, you can't give into it.
Yeah.
You have to do everything you can to keep from falling.
Yeah.
I've had physical therapy, and I've had occupational therapy and speech therapy, and they've all been priceless. I mean, I can't begin to tell them how much it means to me, because they've changed my way of living for the good. They've taught me things that how to button buttons and unbutton buttons, and you think when you can't do it, you think, well, goodness, 5-year-olds can do this. But I used to be able to, but I can't now. But then somebody came along and taught me how to do it. So that is positive input.
Yeah.
It was the therapist that did it.
Well, that's awesome. Thanks so much for talking with us and just sharing a little bit with us about what it's like to have Parkinson's, and just the encouragement for us about how to work with people with Parkinson's in the future.
Every one of them, I hope, will appreciate it.
Yeah.
Because if they experience what I did, they certainly will.
Well, thanks so much.
You're welcome.